Hello, Holistic Matters podcast listeners. This is the 17th episode of the Medicinal Herbs series, and we're joined today by naturopath and medical herbalist Berris Burgoyne to talk with our host Sara Le Brun-Blashka about bone health, medicinal herbs to support healthy bones, and osteoporosis, which impacts the lives of approximately 54 million Americans.
Well, we are so excited to have Berris back with us to really have a discussion about bone health tonight, and specifically osteoporosis and what we can do to stop it from happening. And so, Berris, thank you again for joining us. It's always a pleasure to have you on our podcast. So today I want to ask you really first, what is osteoporosis? So we all can level set our understanding of the topic.
Okay, thank you. Look, osteoporosis is a condition where the bones become really thin and weak and fragile. They really lose the bone mineral density that makes the bones very strong. And when this happens, and particularly when it's severe, even a minor bump or a minor accident can actually cause a broken bone. So, it is a serious condition. According to the National Osteoporosis Foundation, approximately 54 million Americans have either low bone mass or osteoporosis. So they're quite astounding figures, really. So it is a big problem. And I think it's something that sometimes isn't taken seriously enough and isn't addressed enough in clinics to get early diagnosis and prevention.
A lot of times we hear this words, we hear osteoporosis, which you just talked about, but sometimes we also hear a term called osteopenia. And what is the difference between those two?
Okay, thank you. Osteopenia is diagnosed when there's some loss of bone mineral density, but it's not actually severe enough to be diagnosed as osteoporosis. So if you can be diagnosed with osteopenia, then you can put a lot of measures into place to prevent it developing into osteoporosis. Not everybody who's diagnosed with osteopenia will go on to develop osteoporosis, but they probably will if they don't put measures in place to stop that bone mineral density loss.
So it's kind of like if you think of pre-diabetes into diabetes, right? If you can catch it early, you can prevent it from going to more.
Exactly. Right. That's absolutely right. Yes.
Yeah, I think, obviously it's important to have those early measures. So, when we know that osteoporosis specifically becomes more of an issue in men than in women, and so in which I would assume osteopenia is the same too. Why is that? Why are women more likely than men to have this concern?
Yes, it is much more common in women, particularly older women than men. And there's a few reasons for that. One is that, the female hormones, estrogen and progesterone, which everybody is familiar with, we usually have those in abundance prior to going through menopause, and they play a really important role in building bone and maintaining bone integrity and strength. But of course, after menopause, leading up to menopause and then after menopause, the levels of estrogen and progesterone really decline significantly. And so we don't have that protective effect any longer on the bone. And that's why we can see more loss of bone mineral density in those postmenopausal years than previously. But also what happens quite often in probably everybody as they age, not just women, is that as we get a little bit older, quite often we become less active and we're not doing the amount of activity that we might have done when we were younger. So that can also accelerate this bone mineral density loss, because we do need to have exercise in order to keep our bones strong. But it's not only menopause that reduces the female sex hormones. Any women who start menstruating quite late are at increased risk of osteoporosis and osteopenia later in life, simply because they have less years with that high estrogen to continue building the bone. Or women that have extended periods without menstruating. So, women that suffer from eating disorders, for example, will usually stop menstruating. Women who engage in very high level sporting activities will often stop menstruating. And this simply means if they're not menstruating, they're not producing enough female sex hormones. And on one hand, we can say exercise is essential for building strong bones. But if you're overdoing it to the point where you stop menstruating, then you have that reduction in female sex hormones, and that is very counterproductive. It's really important to have good reproductive health right through our reproductive years so that we do have good levels of those hormones to build, strong bones, apart from other things that those hormones do.
If I kind of recap what you're saying, right, key things is having a strong overall, sexual health as a woman, making sure that our hormones are balanced, throughout, starting really early. So it's not something that, I should be thinking about when I'm 65. It's something I probably should really start thinking about even at 20 or before.
It's really important to start thinking of it early because we're building bone right through our early years. And in fact, our bone mass peaks in our late 20s and early 30s. So we've got till maybe our early 30s really to build good, strong bones, because after that, we're not building bones so much. We're maintaining what we have and it gradually declines. So it's really important that we're more active in our younger years. And of course that, in previous generations, that really hasn't been a big problem because kids have always been fairly active by nature. They're energetic and active. But we don't see that quite so much now with computers and gaming and that sort of thing. And children don't necessarily have the freedom in our modern societies to go out and play on their own and that sort of thing, ride bikes to school on their own and that sort of thing that used to happen in previous generations. So younger people are missing out on some of that good bone building activity that is really necessary. And we also see in more modern times, so much fast food being consumed by people, including younger people. So it means they're probably not getting a lot of the nutrition they need to build strong bones as well. So I think it'd be interesting to see what happens in 20, 30 years' time or longer with the levels of osteoporosis, because I think we may see an increase simply because young people may not be building good, strong bones in those years up to the late 20s and early 30s.
Yes. So that's a really, I think, important point that our bone health early on continues. So managing our hormones, having that weight-bearing activity, those good exercise. Is there any other factors that we should also consider?
Well, there's some factors that we can't do a lot about, our genetics. And part of our genetics quite often is our build, what is our physical build like. And so for women who are naturally very thin and maybe fine boned, very small body frame, they're at increased risk of having osteopenia and osteoporosis later in life, simply because they don't have so much bone mass to start with. So any loss of bone mass at all is much more significant in them than it is maybe in larger framed women that have larger, stronger bones. So there's nothing much we can do about that. Women who have that very fine frame need to be aware that they may be at increased risk, to make sure that they're doing the exercise and avoiding the lifestyle risk factors. And they're things like poor nutrition. We have to have good nutrition in order to be healthy and to have strong bones. Things that will increase bone mineral loss is excessive alcohol and cigarette smoking. So we don't see so much cigarette smoking in society now as we may have many years ago, but certainly excessive alcohol consumption is an issue, and I see it in many of my patients. And you may have heard me define this in my cardiovascular podcast, but I think it's really important. What does excessive alcohol consumption mean? according to authorities in the United States, anything above 20 grams of alcohol per day for women or 30 grams of alcohol per day for men is excessive. So what does that really mean when we think about, well, how many drinks does that mean? A 5-ounce glass of wine or a 12-ounce beer is 14 grams of alcohol, and that's a standard drink in the United States. So if above 20 is excessive, that means that women can't have more than, can't even have 2 full 5-ounce glasses of wine without being considered to be drinking excessively. And men can have 2 wines or 2 beers, and that would be about it for them. So, and most people, when I talk to people in my clinics and when I'm talking with groups, most people don't realize that. They think excessive alcohol consumption is, if you're getting really plastered, then that's excessive and you probably shouldn't do that. But it's much, much less alcohol than that. And of course, it becomes a bigger problem if you're doing that every day of the week. So I think this is a really important message to get out, because I'm not sure what it's like in the United States, but in Australia, the group that health authorities are most concerned about with excessive alcohol consumption is middle-aged women. And they're the ones that are most at risk of developing osteoporosis. So this is a discussion we need to have with the community generally, because most people, if they know what the right thing to do is, most people will do it, but they often don't know.
And I think there is definitely this, this wine culture that has, come up forth the last few years, where a lot of middle-aged women are consuming more than 2 glasses a night, almost every night. And so it was interesting. I've recently attended a seminar at a convention where they were talking about the same topic. And, it's really important that women think about that. It's fine to have a glass of wine, even if you do just 1 glass every night, but you don't need a glass probably every night. Enjoy it and find time, right, to have that, if that's part of something you like. A glass here and there is fine, and also may have some benefits, right? It's not excessive, and excessive is easy to happen.
I think it's become our go-to in our societies for relaxation at the end of the day. And it's, there's better ways to relax. It's quite a pleasant way to relax, and it's quite an addictive way to relax, actually. Right. You can get into that habit very quickly, and you can get into, maybe having 1 glass, and then you might say, oh, I'll just have 2 glasses tonight. And then that can become the habit. And, I've seen women in my clinic that have multiple glasses of wine every night. They might have just started having 1, but gradually, I've had a hard day, I'll have, an extra one tonight. And then that becomes a habit. So, but it's also a habit that is not that difficult to break. Most people I talk to, if they just go 2 or 3 days without any, then they don't think about it so much, and it doesn't become such a go-to. So, it's one of those things. The best way to stop craving it is just stop having it for a little while.
Right. So, is there any other factors that you wanted to touch on before we move forward to kind of thinking about how do you know that you have osteoporosis?
Well, before we go on to how we know, there's one other factor is there's a commonly used drug, cortisol, and sometimes it's an essential drug for people with chronic inflammatory conditions, and it's often used short term just to really shut off that response. But people who have been on very frequent doses of cortisol during their lives or had it long term are also at increased risk of osteoporosis, because the cortisol actually reduces bone mineral density. So it's important, if you fit into that category, it's important that you make sure that you go and get checked for osteopenia and osteoporosis. I would say before menopause, if you've been on that drug a lot throughout your life, just to see where are my bones at, and then what do I need to do to prevent it going further if there is a problem. So the way that osteoporosis is diagnosed is through a bone mineral density scan, and that's a particular type of X-ray, and it's called DEXA quite often, DEXA for short. So once you have that special type of X-ray, you're given a T-score, and that T-score will tell you if your bones are perfectly healthy or if you may have some degree of osteopenia or a degree of osteoporosis. And they usually scan the hip joints and they scan the lower spine, and they look at both of those areas. So, and often the hip joint is quite often what we will see where there's bone issues. And I think it's probably a little bit easier to diagnose in that particular joint than in the spine itself, because also as we age, we can get some degenerative changes in our spine that can mask what's seen on the DEXA. But I think it's important to do that. The problem is that a DEXA is often only performed in people after they've had a fracture.
Mm-hmm.
And it's often a bit late then. Don't wait till you have a fracture. Particularly if you're female, and particularly if you're post-menopause, you should be having a DEXA every few years just to keep an eye on your bone mineral density. So if there is a problem, you can do something about it and prevent it progressing so that you don't end up with the fracture. Because once we lose that bone mineral density, we can't get it back. So we have to maintain what we've got at any given point.
Right, exactly. The DEXAs are not always available, and I don't know that everybody understands that they regularly should be doing that. So I think that's a very valid, point that, as you get older, you should be checking it because there are things that can progress, and you want to make sure that you're watching that. Because to your point, Berris, I think it's really important that you want to maintain what you have so you can, stop the degradation that can happen.
And I'm not sure how the health system works in the United States regarding DEXA scans, because if people have to pay for them, they could be expensive, and that is prohibitive for people. And in Australia, you can get free DEXAs if you're in a high-risk group. Otherwise, the government health system will pay for some of it, but you have to do a contribution. And I know when I first asked my doctor to order me one, he said, oh, you're not in the high-risk group, so you'll have to pay some money towards it. And I said, what do you mean I'm not in the high-risk group? I'm a postmenopausal woman. He said, yes, but you haven't had a fracture. I just laughed and said, oh, so I've got to have osteoporosis, have the fracture, and then they'll do a scan. He said, yes, that's right. I don't make the rules.
Wow.
So just interesting. And when I spoke to people at the X-ray place where I had the DEXA done, they said that they would often have women come in with a referral to have a DEXA, and when they're told that they've got to make a contribution to the cost, quite often the women will say, I just can't afford it. I can't have it. And for me, that, is very short-sighted on the part of healthcare systems, really, because it's much cheaper to do a DEXA scan and help women prevent osteoporosis than it is to deal with the health costs of it once it actually happens.
Right. We've talked a lot about women. What about men? Are they at risk also?
Yes, they are at much less risk though than women, and men will get osteoporosis much less than women will, and they will usually get it much later in life than women will. Now, we've talked about the female sex hormones, but the major male sex hormone, testosterone, if men have low levels of that for some reason in their earlier lives, then that can put them at risk. But that's not such a common scenario, but it does occur. But one of the reasons why men are at decreased risk is that men are usually much larger, they have more muscle mass, they have more bone mass to start with. So if they lose a little bit of bone, it doesn't have the same impact as when women with a smaller bone mass to start actually start losing bone. So that's one of the main reasons why men don't get osteoporosis much sooner. But it can happen. And many years ago, I had this gentleman that used to do handyman work around my house. And, we have some hot days in summer here, and I'd be constantly saying to him, oh, do you want some water? Do you want some water? And he'd be saying, no, I don't drink water. I only drink Coca-Cola. Saying, well, you really should be drinking water. No, I don't drink water. Anyway, he had such an addiction to Coke. He told me that he used to wake up during the night to drink Coca-Cola before he could go back to sleep. And I used to, give him the odd little lecture now and then, but it was a bit pointless. And he said to me one day, he said, I had to go and have a bone scan and I've been diagnosed with osteoporosis. I said, that's all that Coca-Cola. He said, yes, that's what the specialist told me. So very interesting. And he was a large, strong, hardworking man who you'd think would be the last person to get osteoporosis. So it just goes to show that lifestyle factors can play a big role. So any man that's drinking alcohol excessively could come into the same situation. So it can happen, but it is rarer in men. But we need to educate the general public. We need to educate our patients about these health concerns, particularly as we age, and how we can prevent them.
We've talked a lot about what it is. What are some of those lifestyle factors? How, if we have somebody who is diagnosed, how can we support them to improve or maintain where they're at for both osteoporosis and osteopenia?
I think the most important thing is to really educate on what we need to do to maintain healthy bone and what we shouldn't be doing, because it will cause loss of healthy bone. Mm-hmm. So, and I've talked about cigarette smoking, excessive alcohol, etc. We absolutely need to have a good diet. And of course, this becomes more important as we get older. So we need whole foods, fresh fruit and vegetables, nuts, seeds, grains, unprocessed. We really need to minimize our heavily processed food because it's full of empty calories, doesn't give us any nutrition, gives us a lot of calories, and actually uses up a lot of the nutrients to process that food that are really needed to build bone. So not only are we not getting the nutrients, we're using up the ones that we are getting in other food or that are stored that should be going to building bone. If we don't have enough calcium in our diet, for example, the body will then start breaking down bone in order to get calcium into our system, because calcium's needed for a lot of things, including good nerve conduction and muscle coordination. So the body's going to make sure there's plenty of calcium there in order to perform those tasks. So it will just break down bone in order to do that. So that's one way that we can lose bone, is just not getting the nutrition that we need in our foods. Mm-hmm. We can use nutritional supplements sometimes. There's a lot of nutrients that are really important for building healthy bone. I've talked about calcium, and of course most people are familiar with vitamin D is really important for the absorption of calcium so that we can build bone. It's important for a lot of other things as well. And many people are low in vitamin D. So we need to make sure that we're getting it in our diet, and that's not always easy, or we're using supplementation of vitamin D, but magnesium and zinc, silicon, there's other nutrients that are very important. And there's some herbs that have been shown to be beneficial for maintaining good bone health as well, particularly black cohosh and red clover. But I really urge people, if they're wanting to use supplements, to go to a healthcare provider that can prescribe the correct supplements for what they need, because we can buy all sorts of supplements over the counter. Sometimes the quality is a bit questionable, but also often we're not really aware of what we actually need. So I've seen lots of patients come in with bags of things that they've bought over the counter, and most of them they don't even need. They've just wasted their money, and sometimes they've doubled up on a whole lot of nutrients unnecessarily as well. So it's really much more efficient health-wise and much cheaper on your pocket if you can go to a healthcare professional and have the correct supplements prescribed for your particular situation. But, one of the key things that we really need to do to maintain bone is weight-bearing exercise. And unfortunately, just walking is usually not enough because your body gets so used to walking, it doesn't exert a lot of stress on the joint muscle connections, and that's what causes bone to be maintained and built. So if you're walking up a lot of hills or walking down a lot of hills, then that's more beneficial than only walking consistently on flat ground. Walking is great because it builds cardiovascular health. It does a whole range of other things. But when it comes to bone health, we need a range of activities. And I would suggest that if anybody has been diagnosed with osteopenia or osteoporosis, it's probably beneficial to go to a professional, someone that specializes in exercise for bone health. And they will design exercises to deal with your issue. Where is the bone mineral density loss? Is it in the spine? Is it in the hip? And they will give you specific exercises to do for that, because the exercises will be different depending on where the bone loss actually is. And they can work out exercises for your body type, etc., etc. So exercise is one of the most important things. It doesn't matter what else you do, supplementation, good food, all of that might be important, but if you're not exercising, you're not going to maintain healthy bones as you age. And along with maintaining healthy bones, we need to maintain good muscle mass as well, because that helps with bones, building bones. And of course, it keeps us steady and prevents us falling as we get older. And all these exercises will also help to build good muscle mass. So that is the number one message here, is weight-bearing exercise.
Yeah, I think a lot of times people forget that like osteoporosis and sarcopenia are so tightly, bound together, right? And you need to make sure that you have that strong weight-bearing activities to maintain both healthy bones and healthy muscles.
Yes, that sarcopenia, or loss of muscle mass as we age, is one of the biggest health risks in the aging population.
Right.
Because muscle mass does a lot, it helps maintain metabolic health, but as I said, it helps to keep us steady.
Right.
And if you've got not, adequate bone health, but you're managing, but you've got low muscle mass and you happen to fall over, that's when you're going to break a bone.
Right, exactly. This has just been a great conversation. Anything else about bone health that you, specifically about osteoporosis and osteopenia, that you'd like to kind of part with our audience tonight?
Yeah, I think we've just about covered it all. Eat well, minimize alcohol, don't smoke cigarettes, and do your exercise. It's not that difficult, really. It's pretty simple.
I'm going to go do some squats right now and make sure my hormones are at balance. Definitely.
Yes, fantastic.
Well, Berris, it's always a pleasure to have a conversation with you. And thank you so much for shedding your knowledge, light on the rest of us. And this is such an important topic, especially for us women, but also for the men out there too. So thank you so much.
Right. Thank you.
Bye.
Thanks to Berris for joining us to talk about osteoporosis and bone health. Listen to more podcasts with Berris on our channel and visit WholisticMatters.com for more on bone health, as well as general health and wellness education. That's holistic with a W.